Hi, this is board certified plastic surgeon Sean Doherty from Boston, Massachusetts. Today I want to talk to you about Voluma. Voluma is a hyaluronic acid. It's manufactured and distributed by Allergan, which also makes the rest of the Juvederm products as well as Botox. And Voluma is special because it's pretty much gold standard for mid-face volumization, so injecting cheeks and creating a lift and creating some more structure where people maybe don't have that so much from their own cheeks. Pretty much gold standard in my practice for that area. But most interestingly and timely is that just recently the FDA approved Voluma to be injected in the mid-face with a cannula. And so what does that mean? That instead of a needle, which is what I've been injecting Voluma with thus far, I can now use a cannula. And the cannula is a blunt instrument that creates less trauma to the tissue. So unlike a needle that's sharp, that goes through skin, a cannula is placed through an already made hole through the skin and injected smoothly in the subcutaneous tissue that's underneath the skin. So a cannula does not break through skin and therefore again causes less trauma and swelling. Most importantly is that it causes less injury to blood vessels, and putting filler in a blood vessel is one of the last things that I want to do for a patient because it can compromise the skin. And so a needle has more of a chance of getting close to a blood vessel and a cannula is less. And I urge you to talk to your board certified injector or practitioner to ask more questions about how that applies to you. So for this lovely patient, I've already injected the right side of her face with Voluma with a cannula, and I'm going to do the same thing on the left side. She's already numbed in an area where I make my small poke hole, and that's with lidocaine with epinephrine. And now, like all patients that I inject filler on their face, I'll wash her twice. The first time is with alcohol. The second time is with chlorhexidine, which is also what I use in the operating room to prep surgically. I do think we owe it to our patients to wash their faces twice before injecting. It creates the less opportunity for the needles and cannulas to bring down skin bacteria. Now, I'm going to do a quick marking of just where I want to inject this filler. So these markings pretty much show where the mid-face is. And this is, to me, an important point on her cheek that will cast a shadow, create and show the shine of light. And this is what I would emphasize, and that's where I'll start my injections. Then I'll create a linear injection in this pattern in a moment. And now, since I just marked her, I'll wash her again with chlorhexidine to prevent any infection. So now here is the cannula. And I'm going to open up my little poke hole one more time. And this is my cannula going in the skin. And here we go. So injecting in a linear fashion. She's feeling some pressure, but not a lot of pain. There is lidocaine that's already mixed with the filler as well. So the more product that's in there, the more numb she'll feel, which is beneficial. You see me tracking along her cheekbone, which is also known as the zygoma. And my cannula is just pushing through the soft tissue area and not damaging the surrounding tissue. And you can see I'm focusing in this area right here because the apple of her cheek, I think, is a nice prominent place to emphasize filler. So that was a cannula. That was about half of a syringe. I always like to top off filler done with a cannula with a needle. So using the same needle that comes in the packaging with Voluma, I'll smooth this area out, and I'm cleansing one more time. And now I'm avoiding any of the marks that are on there. Now I'm just emphasizing that zygomatic arch. And just a little bit of bleeding, which is very normal for filler in this area. And this filler is just complementing what was just injected with the cannula. And that was called a bolus fashion of injecting. And now I'm just going to do a little bit of a cross hatching to again build up that cheek. Okay, so I'm going to massage this a little bit and then acer. We can take a peek. She looks quite nice. So my beautiful patient is just a little bit more beautiful. Okay, so that was Voluma with a cannula and a needle. Thanks for watching.